Bismillahirrahmanirrahim. This is Dr. Usman akhtar and welcome to my YouTube channel. Today we are going to study about a muscular disease which is called Duchenne Musculodystrophy. Duchenne Musculodystrophy is an inherited X-linked recessive condition. First, we should understand what is meant by X-linked recessive disorder. It is mean that this disease will only occur into a male child. A female child can be only a carrier. And each pregnancy will have 25% chance that the one baby may get this disease properly, and their child must be male. In this condition, the dystrophin protein cannot be produced. Dystrophin protein is basically intracellular. Basically, it connects intracellular cytoskeleton, which is actin, to the transmembrane protein and help in the contraction, and they make a proper complex. This disease, its incidence is 1 into 3500 male birth, because it is only happen in the male child because it is X-linked. Female child, usually they are carrier and they are asymptomatic. Look at the clinical feature. The disease onset is very early in age, and they have delayed motor milestone, like they start to walk very late and other motor milestones. The baby boy child lose ability to walk within age 8 to 12 year. Now, this is very important concept to understand. If you see a male boy age of 8 to 12 and you look at him in a wheelchair, then consider this disease, the Duchenne Musculodystrophy. Difficulty in climbing the stairs. The patient cannot be able to climb the stairs. There will be a specific gait. This is very important to remember in diagnosing our clinical scenarios. There is a specific gait which is called wadling gait. This is very important, Gower sign. Ask the patient to sit down on the floor, and then ask him to get up from there. The patient will use their hands or upper extremity to stand up from the ground. This is called Gower sign positive. And there will be progressive muscle weakness. Another is pseudo hypertrophy of calf, because they use so much this calf muscle. And another is because of the extra deposition on the calf muscles of fibroblast. Another is respiratory failure because of the weakening of the muscle. But one important thing to remember, the cause of death in the Duchenne musculodystrophy is dilated cardiomyopathy, because dystrophin is also present in the cardiac muscle as well. So the most common cause of death in Duchenne muscular is dilated cardiomyopathy. Now, diagnosis is important in this condition because of the myonecrosis, there will be high creatine kinase in aldolase level, and they are usually more than 5,000 international per unit. This is very important point to diagnosis. Another is, if we do a muscle biopsy, there will be absent dystrophin in the muscles. Treatment, there is not a specific treatment for Duchenne muscular dystrophy, but physiotherapy play a key role here, because it can slow down the progress of a disease. And sometimes steroid also have a transient role in that delaying the process of the disease. Thank you so much.